Welcome to another installment of Gateway Today. I'm your host, David Cash Vasquez, and Gateway Today is that program that talks about all things Gateway Community Health Center. And today's show is all about giving you an update on all the great things that are happening here at Gateway. First, we head over to Bethany House of Laredo to talk to our Chief Operating Officer, Daniel Cabrera III, who will talk a little bit about our Heroes in Healthcare initiative. We'll also get a chance to catch up with our congressman representing the District of 28 right here in Laredo, Texas, none other than the Honorable Dr. Henry Cuellar, who will also fill us in on funding for this Heroes in Healthcare initiative. We head over then to pharmacy and catch up with Dr. Cesar Banuelos, who will give us the latest and greatest updates on all the great things happening in the world of medication. Then we get a chance to talk diabetes, type 1 and type 2 with our Chief Medical Officer, Dr. Mary J. Cortez. It's a fun-filled show, jam-packed with information from the world of medicine right here from Gateway Community Health Center. So sit back, relax, kick your feet up. Another installment of Gateway Today starts now. Welcome to another installment of Gateway Today. Well, as promised, we head over to Bethany House of Laredo, where we get a chance to take a deep dive into the Heroes in Healthcare initiative, a program specially designed to help the underserved in our community with both medical and behavioral health services absolutely free. Check it out. What's going on, ladies and gentlemen? We are here at Bethany House of Laredo. We're excited to announce a wonderful initiative spearheaded by this man next to me, and I'm happy to finally bring him onto the program. I've been trying to get him away from work because he's always busy, and I finally got him, our Chief Operating Officer, Mr. Daniel Cabrera, who has been spearheading this initiative here with Bethany House in partnership. Dan, thanks for being on the program. Tell me a little bit about this initiative and what was the idea behind it? Like, where did it come from?
Thank you, David. Initially, we had a conversation last year around the winter time during the holidays. We were doing a donation, and I approached Monica and Javier from Bethany House and asked them, how can Gateway be a part of Bethany? Obviously, Gateway is the safety net of the community, and it only felt right that Gateway should be participating with the homeless population. And we talked a little bit about the services that were lacking within the homelessness population here in town. And I think that the thing that kind of stuck out the most was that there was no continuity of care for the medical services. The homeless population were seeking care outside of here. Some of them were our patients, but the issue was that they were having to go in, and so there was no continuity built into it. After a long discussion and seeing what we could do, I approached Mr. Lopez and the board to see if this was something that we could bring into Gateway and have something that we could do. And obviously we had the mobile unit. The other part of the idea when I was pitching to the board and to Bethany was that I wanted to adopt the same idea that they had with the resource center. They wanted to bring in everything on site. We didn't want them to go for anything. They didn't need to go to the pharmacy. So right now we deliver medications to anybody that gets seen in our mobile unit. We come do lab work on the mobile unit for anybody that needs to get lab work done. And obviously we do the medical care on site. It's part of our funding that we did some fundraiser called the Heroes in Healthcare. We were able to reallocate some of the funding for the homelessness initiative. And it not only includes primary medical care, it also includes primary behavioral health care. So it's a collaboration between this organization and Gateway that just from day one has been very successful. I tell Javier and the group that we're really, really happy with the outcomes that we've seen and the consistency, and we're seeing them. We're pretty busy almost every day that we're out here, so we're really happy about it.
Yeah, I mean, when you talk to folks about the care that's being received out here, hats off to you, Dan, and everybody else that comes out here and really had that vision to make this work. Talk to me a little bit, though, about the services, because I know you touched on them a little bit. any one of them Bethany House clients can really walk in and take advantage of these medical services, something that's never been done before, right?
Correct. And I think that's the draw, right? They don't have to pay for services. We've got it covered through some alternate funding source. They come in, they get seen, they don't have to worry about anything. The only thing they need to do is register with us, and then they can access all the services. Now, not everything is available on site. Obviously, we do radiology, we've got x-rays, we've got ultrasounds, and soon we'll have the mammography machine there at Gateway. So those, they would have to go, but Bethany has been really great about trying to find transportation, trying to kind of continue to connect us. And they also use our navigators to make sure that they're connecting with the services in case we do have some people that kind of get lost whenever we're trying to bring them in. But they qualify for every service. So they can also go and qualify or be seen for dental. Obviously, that's something that we don't bring. But definitely once they get into Gateway, they're able to access everything that we have available. And this is not just for the homeless shelter. Anybody in this area that would like to be seen in our mobile unit would be able to access it at any time as well.
Yeah, and that's the beauty of it. It's continuity of care, a program that we foresee servicing the entire area of downtown Laredo. And this is just a start. Danny, thank you so much for all the work you're doing. He's our Chief Operating Officer at Gateway Community Health Center. He is Daniel Cabrera, and we're thankful to him and his efforts right here at Bethany House. A special shout out to Daniel Cabrera, our Chief Operating Officer right here at Gateway, for making this dream a reality. When we come back, we talk more Heroes in Healthcare initiative with our very own Congressman, Dr. Henry Cuellar. Stay close, more Gateway Today on the way.
Gateway Pediatrics invites you to make an appointment for your child's next pediatric visit for your wellness checks, pediatric vaccines, physicals, and for any other healthcare needs. With 6 clinics to serve you. Call Gateway Pediatrics at 956-795-8100.
Gateway Sports Medicine has grown leaps and bounds to provide quality health care for everyone in Laredo and the surrounding areas, providing multiple sports medicine services for adults and children. Now we welcome Dr. Eduardo Garza, our new sports medicine physician, to our team, helping the athletes of Laredo be at the peak of their performance. Dr. Eduardo Garza brings his knowledge and experience to Gateway Community Health Center. With school around the corner, get your star athlete checked out today and welcome Dr. Eduardo Garza to Gateway Sports Medicine.
Welcome back to Gateway Today. Well, before the break, we said we would continue talking about the Heroes in Healthcare initiative, a program specially designed to partner up with Bethany House of Laredo. And we got a chance to catch up with our Congressman, Dr. Henry Cuellar, to speak a little bit more about the funding for this initiative. Check it out. So as we continue our conversation about Heroes in Healthcare and the Heroes in Healthcare initiative, I'm blessed to have our Congressman representing District 28 of Texas, none other than Dr. Henry Cuellar.
Hey, it's always a pleasure.
Congressman,
being with you.
Thanks for being here. Really quickly, talk to me about the importance of funding healthcare here in South Texas and the work that you're doing in Washington.
Well, first of all, let me say this. What y'all are doing has just been amazing. Since the leadership of Elmo Lopez, folks like you that worked so hard for the Gateway Community Clinic, 4 clinics at one time, now we're 10. And with the mobile clinic that's just a few feet away from us, that will provide services to areas like downtown or like Bethany House that can provide medical behavior services, providing services for areas that have not had this type of care. Downtown, it's not only for Bethany House, but as you and I were talking about, people that live around this area will have some sort of care that will be provided, medical and behavior.
Yeah, well, the work that is being done in Washington, the funding that's being brought down to support programs like this, what drives you to support these programs?
You know, 2 things that we've had what I call historical deficiencies in funding have been healthcare and education. That's why we created Texas A&M International, helped in other areas, but also the healthcare is another area. So this is why I've been a big supporter of community clinics, federal clinics, making sure that we provide the funding, because if you look at what your clinic has been receiving in the last since 2021, almost $29 million. And the services, money is one thing, but the services depend on the innovation, the creativity that Elmer Lopez, Danielle, and other folks have provided. Thinking outside the box is what Gateway Community Clinic has.
Well, Congressman, I want to thank you for the millions of dollars that you continue to provide, not just for Gateway Community Health Center, but for the entire community of South Texas. We appreciate all the work that you're doing. And ladies and gentlemen, if you want to find out more about the Heroes in Healthcare initiative, make sure you get over to our website, gatewaychc.com. Our special thanks goes out to Dr. Henry Cuellar for supporting all things Gateway Community Health Center and, of course, our Heroes in Healthcare initiative. We said we would head over to pharmacy to talk to Dr. Cesar Banuelos about some of the great things that are happening in the world of medicine. Check it out. Well, ladies and gentlemen, we are here with our favorite pharmacist, Dr. Cesar Banuelos, who is here to tell us all about some exciting drugs that are available to our patients here at Gateway Community Health Center, but more importantly, to talk a little bit more in depth about these life-saving, life-changing drugs that are available for our patients. And Dr. Banuelos, thanks for being here. I know I always kind of force you to come on camera and share your knowledge with us, but I think it's only proper to bring you on because, one, obviously you got a wealth of knowledge when it comes to the pharmacy and pharmaceuticals and everything that's happening within the industry. Let's talk first about, because there's a lot of folks out there, a lot of our diabetic patients who are looking for or are maybe already on some of these prescription drugs like the Ozempics of the world, like Wegovias. Tell me about those and what's going on with our diabetic drugs.
So Mounjaro and also Ozempic, those are the traditional, or I guess now they become traditional drugs that we're seeing a lot of people on. And great drugs. You know, if we look back at some of the trials at how much percentage weight loss you could get with these drugs. So if we think about semaglutide, which is Ozempic, you get anywhere in the range of maybe like 15% weight loss. And Mounjaro with tirzepatide, you also get around 18% weight loss. So obviously the tirzepatide gives you a little bit more weight loss. But aside from that, you obviously get the benefit of A1C reduction. You could get other added benefits such as blood pressure control, kidney benefits, and things like that. And the main thing about these drugs is the way they work. And so one of the key things about them is that the incretin mimetics, or GLPs, like these drugs are called, they've been around since 2005. 2009 is when we saw Victoza come into the mix. And so 2009, we started to see Victoza, which is liraglutide. And that's when the company started to think about using these drugs outside of diabetes, because with the advent of Victoza or liraglutide, we saw Saxenda, which was the first GLP-1 that was used for obesity.
So they, after like years of research and development, and it come to find out, oh my God, these drugs actually help people lose weight as well, right?
Yeah.
And that's sort of the miracle of medicine kind of going full circle. Aside from just treating diabetic issues and diabetic patients, this helps us lose weight, right?
Absolutely. And the way they do it is really intriguing because, you know, they slow the way your digestive processes work. So they allow, it's kind of like doing a job. Instead of doing it fast, you kind of do it, you know, meticulously type of thing. It also helps with insulin production in the body, but it's dependent on the amount of glucose that you have in your body. And it also increases satiety. So the body will send signals from the gut to the brain to kind of have this sense of fullness. And some of the newer ones, like tirzepatide, has not just GLP, but GIP. And what that adds is that it basically augments the response of the GLP, but it also helps with adipose tissue. And one of the key things about it is that it promotes the strength of the white adipose tissue. Because if you don't promote that strength, you have this ectopic fat that forms. And what is ectopic fat? So ectopic fat is, you know, we always hear this term, grasa en el hígado, right? That's like the classic term, oh, el doctor me dijo que tengo grasa en el hígado, right? And so that's something we don't want, right? So what GIP will do, it'll promote that white adipose tissue so that you don't have that ectopic fat that lines the heart or goes inside of the liver. And so that's all bad because it promotes insulin resistance, it promotes inflammatory responses, right? And so that's the added.
So like fatty liver, hey, I went to the doctor, they said you got a fatty liver.
Yeah, that's exactly
that.
Yes, in essence, they're doing research to look at GLPs in the use of fatty liver disease. And pretty soon we might see something like that in the future. But yes, it helps. GIPs, GLPs should essentially help with that process.
Now, let me ask you, because while this is all very exciting news and there's a lot of hype around some of these medicines, what are the things that people should sort of take into consideration when they're thinking about taking some of these medications? And we're talking about side effects here because, obviously we see the commercials and, hey, you're going to take this, but it may give you this. What are things that folks should pay attention to?
So some of the things that I think we've seen on the news, like, we've already heard like the most common side effects, nausea, maybe upset stomach, maybe some diarrhea or constipation. But the things I think really people are focusing on a little bit more, like the first thing would be the plateau effect. Traditionally what we've seen in the trials is that by the course of a year, now everybody's different, there's gonna be some variability. By the year, usually people plateau. So what that means is that your body will no longer lose weight. And it's kind of like a defense mechanism because you don't want to be injecting yourself and then reach a point where you become, very thin.
So somebody who is taking Ozempic to lose weight and they reach this plateau effect, after a while, they're just kind of injecting themselves and they won't see any weight loss. Is that what you're saying?
They will not see the significant weight losses that they'll see. Traditionally, sometimes what we've seen in the trials is that some people respond. It takes them longer to respond than others. But you won't see those same drops in A1Cs. You won't see those same drops in blood pressures. You won't really see a lot of weight loss. And that's, like I said, it's a defense mechanism. It's basically the body has this set weight that it wants to keep you at. And that's based on a lot of things, genetics, childhood obesity, things like that. And so based on that, it's going to tell you, okay, this is where I'm going to stop you. And so in the future, though, we might see more combination between other drugs to try to help kind of push the limit a little bit more.
And so just so everybody kind of understands, right? There's also some other side effects, mainly geared towards females, right? So tell me about that.
So it's really interesting because what we're seeing in the news is that more women are, conceiving more, and it's not too far-fetched because if we think about obesity and other disease states that may happen in women, such as PCOS, which is polycystic ovarian syndrome, those women have traditionally been known to have difficulty conceiving. But what we tell them and what we've seen is that if you lose 10% of your weight, that actually helps with fertility. And so if you think about it, be it bariatric surgery, be it weight loss medications, be it just, diet and exercise, just losing that 10% will improve fertility. And so it's not too far-fetched to be able to see that. So the more weight you lose, the more likely you'll be able to conceive. So that's basically where that's coming from. It's this whole process where what happens is when you have more fat, you produce more estrogen, and that affects certain cycles in the body. Among other things like the production of androgens like testosterone that may happen as well.
If you want to find out more about the medications available within our pharmacy, you're totally invited to come and visit here at Gateway Community Health Center. Come visit Dr. Cesar Manuelos. He is a wealth of knowledge when it comes to the pharmacy, pharmaceuticals, and medications overall. We thank you for your time, man. It was always a great time having you on the program, and we thank you all for watching this installment of Gateway Today. I tell you, it's always a fun time when I get a chance to hang out with Dr. Cesar Banuelos, an expert when it comes to medication and pharmacy. Our thanks goes out to him, and thanks to you for watching as we head over to our Chief Medical Officer, Dr. Mary J. Cortez, who gives us some updates on type 1 and type 2 diabetes. Check it out. Well, welcome to this installment of Gateway Today. We are fortunate, as always, to have one of our favorite guests on the program, our Chief Medical Officer, Dr. Mary J. Cortez, who I always pull away from work and make her come answer some questions that are really, really important to you, the viewer watching. And today we're talking about something really important, diabetes. And it's a subject that has impacted our entire community, Doctora, and thank you for being here as always and being a great sport and answering these questions. But I think it's important for the viewer to understand, you know, that we hear about diabetes, but there's actually like two types, right? You got type 1 and type 2. Tell me what those differences are.
Yeah, the type 1 diabetes usually occurs in the kids and in children, and it's more like an autoimmune disease. And the type 2 diabetes is we see it in later in life and usually occurs because of health, lifestyle, and what we do. Of course, it has to do with genetics and family history, but also how we eat, how we exercise, how we live life.
And that's kind of what we're going to focus on, I think, more is the type 2, because obviously type 1 is something that's inherent, right? Something that the research is showing us, but type 2 is something that we can kind of prevent, right, with lifestyle changes. Yes. Right? Tell me about that, because I love Coca-Cola in the morning. And I know, look at that face, right? But tell me, how can I change my lifestyle so I can prevent those effects later on with type 2?
Oh, definitely Coca-Cola in the morning or like in life is bad, right? And a healthy lifestyle, exercising, the recommendation is at least 30 minutes of exercise a day, most of the days of the week. Right now, we're recommending a lot of weight training, even your own weight. It's going to promote muscle building, less fat in the body. And that's going to prevent insulin resistance. And so that's going to make the insulin work better in your body and less increasing the glucose in your body.
With those lifestyle changes, right? So, okay, I got to let go of my Coke, right? I got to change my lifestyle. But what's happening in the world of diabetes in terms of medications? Let's talk about that, because I've been hearing, you know, you see the commercials on TV, you hear about the research. What are you seeing that's really effective for patients out there wondering, well, you know, is there a way to medicate this? I have type 2. How do I deal with this?
Yes, it's amazing what's happening right now. Progress is happening. We're seeing amazing medications. The injectables right now, the Ozempic, Trulicity, Mounjaro, those are GLP-1's receptor agonists, and it's the imitation of a hormone that we have in our system, in our gut, right? And it helps us to create satiety in our body. It tells us, okay, you're full, you have to stop eating, and it helps with weight loss. It helps with the sugar control, and we're seeing wonderful things in sugar control. Also, the SGLT2s, the Farxiga, Jardiance, Invokana, also it creates release of the sugar through the urine, protects our kidneys, protects our hearts. So it's not only controlling the sugars, but also protecting against the complications from diabetes. And so that's what we want to see.
And, you know, complications, right? Or like side effects, right? Because I know a lot of people hear about these wonderful drugs that are great for these illnesses. What are some of the side effects that people should just kind of like keep in mind? Because I know we hear weight loss, I want to lose weight right away, and I should take this drug even though I'm not a type 2 patient, or like how do I get my hands on this because this is going to cure all things? But there's side effects that do come with some of these medications.
So the medications per se have little side effects, abdominal pain, nausea, vomiting. Some patients present with more severe side effects, and some of them end up in the hospital with severe pancreatitis. Of course, we are monitoring these patients, but the benefits are bigger for these patients, right? Some patients think that the medications are gonna make them lose their sight or like worsening the kidney disease. And actually what makes it worse is the uncontrolled sugars, right? That they're gonna make you lose your vision, your kidney function, your heart functioning, right? So we're monitoring our patients. We're not letting them go into the complication.
Right. And just a note, if you want to know where to get these medications, Gateway does have a pharmacy, and you're able to sort of take advantage of that as a patient here at Gateway. And that's it kind of has me like asking that next question for you, Doctora, is how, what signs should I be looking out for that maybe I don't know I have type 2? What do you think I should be, your recommendation to those out there that might be wondering, well, I've never been diagnosed with diabetes, or I'm having these issues. What should I look out for that may be a sign of type 2 diabetes?
So usually we recommend the prevention, right? Come to see your doctor. We screen all the time, at least once a year. Weight, abdominal obesity. We check for sugar levels. When it's too late, we start seeing a lot of urination at night. When you wake up several times to urinate, you start losing weight, and that's like really advanced disease. But usually is people don't feel that sick. And when you come see the doctor and it's like, oh, the sugars are elevated, and let's do more testing, and or like, well, maybe visual blurry vision and stuff like that.
Holistic approach to primary care and treating type 2. Chief Medical Officer, Dr. Mary J. Cortez, always an honor and a pleasure to have you on the program. If you're wondering about type 2, need more information dealing with type 2, Gateway is a place for you. Simply call 956-795-8100 or visit us at gatewaychc.com. We're ready to help you treat your type 2 right here at Gateway Community Health Center. A big thank you to Dr. Mary J. Cortez, our Chief Medical Officer, who's always a great sport when it comes to Gateway Today and giving us the latest and greatest information when it comes to diabetes and how you can take care of it, how you can manage it. And if you want to learn more about all the great programs that you saw today on today's program, make sure you head over to gatewaychc.com so you can become a patient and see a physician today to get your diabetes under control. Need more information? Don't hesitate. Make sure you hit the number up, 956-795-8100. If you want to catch a full rewind of this episode or any of our other episodes of Gateway Today, make sure you head over to our YouTube channel, search Gateway Community Health Center, and don't forget to smash that subscribe button. As always, we thank you for watching this installment of Gateway Today, and remember, your health is your wealth, so take care of it.
Gateway Sports Medicine has grown leaps and bounds to provide quality health care for everyone in Laredo and the surrounding areas, providing multiple sports medicine services for adults and children. Now we welcome Dr. Eduardo Garza, our new sports medicine physician, to our team, helping the athletes of Laredo be at the peak of their performance. Dr. Eduardo Garza brings his knowledge and experience to Gateway Community Health Center. With school around the corner, get your star athlete checked out today and welcome Dr. Eduardo Garza to Gateway Sports Medicine.